She was a higher ed. What else? Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, we're going to have the elected Pennsylvania State Treasurer Joe Torsella on, but first we're going to hear from the President-elect of the Pennsylvania Medical Society, Dr. Ted Christopher, emergency room physician. You're going to want to stay tuned for this.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, here we are. We're in the middle of summer. We're going to talk about what else, but the horrible opioid situation. We couldn't have a better gentleman to talk about that. Dr. Christopher is the newly elected president of the Pennsylvania Medical Society. Doc, welcome to the program.
Good morning. Thanks for having me.
Oh, look, you're an emergency room physician, and for many people, that's a scary thought. You know what I mean? Because you get to an emergency room when there's an emergency. So is there something that the folks out there should know about this? And we don't know when we're going to need one, but any moment, any of us could. Am I wrong about that?
So I would say to everybody that you're in great hands. I think the doctors who now staff emergency departments in the state are mostly board certified, if not all board certified, or soon to be there. And we're the safety net for healthcare. So you have any problems, we're the ones who are the last bastion for access. So if you can't get to anybody, you come to us, and we will take care of you.
Yeah. The fascinating thing is that for a lot of people to know exactly when you should make the call, people will, well, I sprained my ankle, should I call? Now, obviously, if you're in a car accident or you're having a stroke or a heart attack, and a lot of people aren't aware of that. Is there any guidelines? Is there any kind of rules? I know there's no regulation. Call 911. That's the only thing I know, but go ahead, take it.
So they have something called the prudent layperson idea. So it's really hard because emergencies are in the mind of the beholder. So even ankle sprains, I used to, my girls all performed gymnastics, and they would sprain their ankle during the meet, and the parents would be convinced that's an emergency. I'd say you can wait until Monday to go see the doctor, but in their mind, that's an emergency. So it really is in the eyes of the beholder.
Yeah. Now, when you go into the facility, you normally think of, I'll be honest, chaos, because of what you have to deal with. But there's a plan, right? There's internally, you all know what you're doing in there, obviously, and there's a plan for when you get 15 people.
So it looks like chaos, but it is organized. I can promise you it's organized chaos, and everybody knows their role. It's a great team. It's probably one of the highest functioning healthcare teams around. So, but all the nurses and the technicians and the registrars and the physicians and of course, I'm an academic, so I work at Jefferson Hospital, and we have medical students, we have residents. Everybody has a role, and so even in a dire emergencies like a trauma case or a heart attack, everybody knows their role, and it works pretty well.
Is the staffing in general of emergency rooms, has that increased over the last few years? Just as a layperson, I would think it has.
Absolutely. As it gets busier and busier, and as the volumes increase, and our volumes have been about the same, our patient volumes, but we're staffed adequately with nurses and technicians and of course physicians. But as the volumes have increased over time, then the staffing also increases commensurately.
Yeah. Then the other aspect is once you see the patient, you make a diagnosis, you treat the person, or you refer them, right? What's that referral process like?
It depends. But referral is really everything, especially nowadays, I think. You have to make sure you just can't treat your patient in isolation. So we like to refer them either to the private doctors or to a clinic, or if you have no insurance, I think a free clinic. So it varies. But the follow-up, not just from the emergency departments, but in the hospital, if you're admitted, I mean, the follow-up is becoming increasingly important. And you'll hear about transitions of care and that sort of thing, and what's being funded now. So that's all about that.
Okay, before we go to a break and then move on to an important subject, this is an important subject, obviously. Is there anything you can tell our viewers out there about what they should do? I mean, is it just call 911 and explain what's going on? Is it any more complicated than that?
I think people are pretty smart. I mean, obviously, it's the obvious stuff, a car accident, if you're in
panicking.
Trauma, in panic, chest pain, you can't move your right arm, 911, get to the hospital as soon as possible. These are time-dependent diagnoses, so the sooner you get to the hospital, then the faster we can treat you, and the better it is for you, because we have time-dependent treatments for these diagnoses.
So I guess you would say, if there's any doubt, call 911, that you'd rather see a patient that doesn't need care or your care than have someone not call 911 who does need care. Is that, I got that right? And so
here's the skinny on that. So if they call 911, I mean, the medics and the paramedics are very good. And if they don't, if you're calling in for an ankle sprain, they'll say, well, maybe I'm going to release you, and you can maybe call your husband or your mom and dad and get a ride to the hospital. But they're pretty good about that. If you have any question, just call 911.
All right, we're going to run to a quick break. When we come back, what else? The opioid problem, it's extraordinarily serious. There's been increase in funding in the Pennsylvania budget. We're going to talk to Dr. Christopher about that, and maybe something else after these words.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Well, I'm chatting with Dr. Ted Christopher, who is the newly elected president of the Pennsylvania Medical Society. He's also an emergency room physician. We're trying to get into this business of this transition. It's an important one. You go to emergency room and then what happens, and that's, Doc, I think you would agree, when folks come in with an opioid problem, I mean, they could be literally on the deathbed. There's several angles to it. One is you got to make a diagnosis and make it pretty quickly. How tough is that?
Nowadays, not difficult at all. It's a tsunami out there. It's every shift I work, and I don't work that many shifts anymore, but every shift I work, there's at least 1, 2, sometimes 3 or 4 patients who are brought in by the paramedics or on their own, and they want withdrawal, they want to withdraw from it, or they have to be resuscitated. And as you know, the state, I think we're still losing, 10 people a day in the state here in Pennsylvania die of opioid overdose. It's a tsunami. It's the biggest healthcare crisis, I think, since the HIV and the AIDS epidemic. It's an epidemic.
Yeah. So you would agree? I mean, I don't want to put words in your mouth, but I think you would agree that this is a major public policy issue that needs to be addressed.
It is the major public health issue that has to be addressed in the entire country, not just Pennsylvania.
Yeah. And obviously the legislature has appropriated more money. That's one thing. I think there was a consensus. Not a political issue. It's not a Democratic versus Republican issue, because it exists in all 67 counties, and it continues to grow. So are you telling me that what you see, despite all of this attention to it and these programs, and I may get a chance to talk to the state treasurer about one of them, is that it still continues to grow?
It's still a major problem, and so I can remind people that the HIV epidemic took maybe 18, 20 years to just really solve the whole problem. This is going to be a long-term solution. It's nothing that can be turned on and off. We've done a lot. I think the peak, prescriptions were in 2010 from doctors for opioids. That's come down almost, but it's still 3 times higher than in 1999. So. We're still prescribing too many opioids. It's still an issue, and we're seeing the aftermath of the addiction problem, and so the heroin and the fentanyl.
It comes from a lot. You're right. What I've read and understand is it comes from a lot of prescription drugs. I don't know that I'd want to be a doctor today. You're trying to help people that are in serious pain. And so they want pain medication, and then they get hooked. You know what I mean? It's a tough knowing when to stop and when not. I mean, it must be extraordinarily difficult as a physician.
I think, Terry, you're absolutely right. I think, so we're just learning, I think as physicians, all of the different kind of alternatives, alternative pain modalities, things like cognitive behavioral therapy, things, acupuncture, for example, even Chinese medicine, or things of that sort. But pain coping skills, alternative injections, things like that, lidocaine patches. There are so many other things we can do, but it's an education process. So, and the Pennsylvania Medical Society has been leading that. So there's a bunch of online CME courses that we offer now to teach the doctors how to prescribe alternatives.
Now, before I let you go, I have to ask you one additional question. There is something called, and I just learned this, a warm handoff. Do I got that? Am I using that term correctly?
That's correct.
What is it?
Warm handoff is if you come into the emergency room and you're resuscitated and you wake up and we save your life in the ED, then the question is, what do you do with the patients? And so in the past, they would wake up and they'd leave and they go out and I think seriously just use again.
Repeat it.
And just have repeat. So the challenge is to get these patients some addiction therapy. And so the warm handoff is a program. It's well defined in a few ERs, not all ERs in the state, where you get the patient to the appropriate outpatient or inpatient facility so that they can get treatment for their addiction. And it's not a weekend thing, it's not even a week thing, it takes often months. And I've heard the ideal time frame for this is about 3 months. And so that's a warm handoff. It's finding the right outpatient facility to send these patients.
Well, look, I want to thank you for coming in. I think this is an important update, and we expect to see you over the next year or so, and you can give us some additional updates. All right, coming up, we have the Treasurer of the State of Pennsylvania, Joe Torsella. We're going to have to talk a little bit about the budget, or at least part of it not done. And plus, we're going to get into a couple of important health care issues, and we'll do that after this break.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Well, sitting across from me is the State Treasurer of Pennsylvania, Joe Torsella. He used to run the Constitution Center in Philadelphia. Mr. Treasurer, welcome to the program. Glad to have you back. All right, now as we tape this program, the state has passed the budget, $32 billion. So all the program spending, is prepared, but the money to pay for it is not. And the state is looking at least a $1.5 to a $2 billion shortfall in the revenues it collects this year, or I should say now last fiscal year, and a $3 billion budget. And they're talking about gaming and liquor expansion and borrowing money. Is that the way to, Mr. Treasurer, is that the way to run the state?
The short answer, no. And most people understand that. Is that the way anyone would run their household? Or a business? By saying, let's pass half a budget and let's pass the part that talks about what we're going to spend, not how we're going to pay for it. Look, Terry, the Auditor General and I have now communicated several times with the General Assembly and the Governor. And we've actually, in Treasury, forecast what the general fund balance looks like if this is where we stay, if they've just passed this part. And it is grim. It is absolutely grim. We are underwater, will be underwater for 8 of the 12 months of next year. And in the past, Treasury has been able to support that by loaning the state money, essentially. And we're looking at the magnitude and the duration of this, and we've said you need to pass a responsible revenue package because we can't, again, going back to where we started, any Pennsylvanian would say, if I'm living on my credit card for 8 of 12 months, something fundamental is wrong.
And it seems to me it's also predicated, the budget, that somehow the economy will grow and the revenues will grow from sales, income, or business taxes, the 3 big ones. And if it doesn't, if we don't get 3% growth, we could end up with a larger deficit if the economy doesn't pick up, so it's predicated on that.
And as we're going to talk about, some changes looming in Washington can worsen our situation. But it's what happened this year, which is we ended up with, as you said, last year now.
Yeah, last year. June 30 is the constitutional deadline we'll get for the budget.
We ended up with a deficit. Now, and what we can't do is keep papering over this with borrowing and one-time fixes. We need to be responsible stewards, because really this is, as you know, budgets are really about futures. And every time we skate through and put together a package of gimmicks, we're shortchanging the future.
Right. So one of the concerns I have is with this expansion of gaming. I'm not opposed to gambling. We have 12 casinos. They're regulated. At one point, the House passed a bill that would have put 44,000 video terminal games throughout the state. I mean, I was giving a talk and I said, at this point, why don't they put them in telephone booths? If we had telephone booths, am I wrong about that?
They might take you up on your suggestion. I wouldn't be too. Now, look,
makes no sense to me.
Look, I'm not. Luckily, I'm not a legislator, and
it's a tough job.
It is a very tough job.
I'm not saying it's easy.
But I walked by. I don't know if you've seen the map in the state capitol where it said, if that expansion went through, it had a little pin for every one, and the entire map of Pennsylvania.
I saw that. Well, let's go. I want to go to one other issue, and then we'll turn to health care. Look, borrowing $1.5 billion from the tobacco settlement, that money is supposed to be used for health care needs. How can we keep doing this without putting the long-term fiscal health of the Commonwealth in jeopardy?
Well, we are putting the long-term fiscal. We have put the long-term health.
And it's not new with this situation.
Standard & Poor's just this past week said that if there is not a responsible revenue package, that they're going to downgrade our debt. Now, if this sounds familiar to Pennsylvanians, it's because they've heard it before 5 times over the last 5 years, and it is the working Pennsylvanian who pays the cost of that in increased borrowing costs and in our inability to borrow for the things like infrastructure that really build our future.
All right, let's run to a break. When we come back, I want to get into Medicaid expansion and the debate in Washington. Who knows if anything is going to happen as we speak. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. And by the Pennsylvania Healthcare Association, advancing quality, improving lives.
The State Treasurer of Pennsylvania is my special guest today, and we're talking about a whole bunch of subjects. We talked about the state budget. Now let's get into, I guess, one of the most controversial issues is obviously the health care bill that we'll see if it moves its way through Congress, got out of the House, it's in the Senate. Perhaps the most talked about aspect of it is what would happen to Medicaid under at least one of the proposals, if not more, that currently is out there. And you issued, along with the Auditor General, Eugene D. Pasquale, a cautionary note. What's your note about that?
Yeah, well, briefly, I have...
It's complicated, I know.
It's complicated, and the first place to start, Terry, obviously, is before we talk about dollars, which I'm going to do, this is obviously, in the end, a human story. If, Medicaid and CHIP in Pennsylvania cover nearly 1 out of 5 Pennsylvanians. So there is a dad or a mom or a grandparent listening who's either affected by this or knows someone who is. And there's going to be a real human cost if this, in my view, terrible bill goes through. The Auditor General and I talked, though, about something that we don't talk about a lot, and that is there will be a huge financial cost to Pennsylvania.
Shift to Pennsylvania.
This will be a wrecking ball to Pennsylvania's already, as we just discussed, precarious finances. The Medicaid expansion in Pennsylvania covered approximately 700,000 people, and it's widely viewed as a success. And it covers some of our most vulnerable populations, the working poor. It covers, I think, now 1 in 2 disabled Pennsylvanians, people in nursing homes. I think it's 2 out of 3 are covered by it. Now, if this bill proposes to, over a few years, but in short order, dramatically change the cost and the way that's compensated, there are a variety of estimates what that would do to Pennsylvania's deficit. But the most recent one I've seen is it would add another $1.4 billion. Now, I've seen other estimates that are higher, some that are a little lower, but none that are reassuring.
Right. Let me ask you one aspect of this. Part of that expansion, so if you're able-bodied, you're single, you're eligible for Medicaid depending on your income. Let's say you're unemployed.
Certain percentage.
Yeah. Should there be at least a requirement? Indiana has done this, and I haven't thought very much about it, but it seems to me, is there a problem if you're able-bodied that you should at least have, you got to go look for work? Is there something fundamentally wrong with that?
I think and I haven't looked carefully, but I think what the experts that I've listened to have said is that you're actually putting the cart before the horse, that if you start doing that you'll end up with fewer people working and looking for work, and that there are big issues with doing that, which is why I think you saw a move toward that in the legislature that's drawn a lot of unfavorable attention.
Yeah. So you're I guess for the state, you're really talking, if this goes through, and who knows what's going to happen as you and I chat. The debate in the Senate is endless, and they don't seem, Republicans can't get on the same page. But there is some reforms that ought to be, that the Affordable Care Act, otherwise known as Obamacare, that would make some sense. I mean, does have its problems.
I think there's no one who will tell you that it is a perfect piece of legislation. And by the way, I think everyone should be willing to talk about fixing it and repairing it. But I think what we shouldn't talk about is wholesale throwing it out. The impact on Pennsylvania, I think, would be dire at the individual level, and it would also be dire at the state, at the level of the state and its finances. And it would also be disproportionate where it happens. It would, for example, particularly with rural hospitals, it could absolutely be catastrophic. Yeah. And I know growing up in Columbia County what the impact of a hospital in a community is, and what happens when that hospital is threatened and closes.
Thanks for coming in. Thanks for the update. You're always welcome on the program.
Good to be with you.
We'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.